We were interested in studying patients with oral pharynx cancer that we were treating on 2 internal clinical studies. And there is currently an epidemic of HPV-induced head and neck cancer. These occur primarily in the tonsils, the base of the tongue, the soft palate, and the posterior pharyngeal wall. And they're caused by the same virus that's the virus that causes cervical cancer. Our experience and the experience of other studies has shown that these cancers are very responsive to our current therapeutic methods, but we noticed that some of the patients were suffering late recurrences or distant metastases, and the tumors were behaving differently than standard head and neck cancers. In addition, because they responded so well, we felt that we might be able to cure nearly everyone if we could understand about the outliers, the ones that were having relapses. So we looked at biomarkers and patient characteristics to try and determine what was it that was different about the tumors that were recurring or undergoing metastasis. We discovered that smoking is probably the most important factor in this behavior, the failure of treatment, and the development of recurrent disease. When we looked at this data, we also were aware from many studies in the literature that patients who have HPV-positive tumors are much less likely to be smokers. So we looked at a group of 124 patients enrolled in 2 trials. Of those 124 patients that we were able to study pretreatment biopsies and get DNA for HPV testing, we found that 102 had HPV in their tumor, and the remainder did not. Those 22 patients who did not have HPV in their tumor were all smokers. Of the ones that did have HPV in their tumor, 1/3, 33 of them, were never smokers. And then 68% of the remaining patients who were HPV positive were smokers. So this was a little different wrinkle than what we'd seen in the literature, and it showed that smoking was involved with the development of HPV-induced cancers. And we also found that those patients who were former or current smokers were at greater risk for the development of disease recurrence. Among those patients who were current smokers and HPV positive, 35% suffered a recurrence or distant metastasis. Of the patients who were former smokers, 15% suffered a recurrence or distant metastasis, and only 6% of the never smokers had that phenotype. And one of those patients told us that he was exposed to smoke every day in his job, and he would tell his wife every night how annoyed he was to be breathing secondhand smoke. So we think that smoking really makes these cancers much worse. And the message is, if you are a smoker and you develop head and neck cancer, stop. And if you don't smoke, don't start.